Management of subfertility as per SITM, that is Special Interest Training Module. How to recognize, assess, and investigate the infertile women. To assess women with infertility, take a detailed history, recording menarche, cycle regularity, past medical and obstetric history. If cycle irregular, then additional questions like hirsutism, acne, alopecia, galactorrhea, secondary sex characteristic, previous chemotherapy, or pelvic radiotherapy. Screen for associated conditions, for example, autoimmune factors, genetic causes, diabetes mellitus, late onset congenital adrenal hyperplasia. Take social and sexual history. Screen for previous infections like chlamydia and gonorrhea. Appropriate physical examination including BMI, secondary sexual characteristics, vaginorectal assessment for endometriosis, and visual field if appropriate. Then arrange appropriate endocrine and other investigation to make a diagnosis. After assessment, we do the investigation to diagnose the patient. Baseline investigation including luteal phase progesterone, day 2 FSH, LH, estradiol, and rubella. Endocrine investigation, if appropriate, like baseline hormonal profile for FSH, LH, estradiol, prolactin, thyroid function test, androgens like testosterone, sex hormone binding globulins, FAI, DHEAS, etc. Arranging investigation for impaired glucose tolerance and hypercholesterolemia. Taking vulvovaginal swabs. Discussing other diagnostic techniques like assessing tubal disease or uterine condition, any associated risk or complication. Ultrasound scan of pelvis to assess uterine shape, size, ovarian size, and morphology. Diagnosing endometrioma in pelvic ultrasound. Performing HSG, HyCoSy, or saline infusion sonohysterography. If needed, then CT, MRI scan like MRI of pituitary gland. Then establishing the likely cause or causes of infertility and recording all the results appropriately and referring or performing additional imaging. How to make a diagnosis of unexplained infertility. Explain patient that it is a diagnosis of exclusion. Now, association of infertility with other medical conditions. Always liaison with appropriate specialists for the further management of medical conditions like diabetes with polycystic, pituitary tumor with hypogonadotrophic hypogonadism. Always advise in lifestyle factor in a very sympathetic manner, especially the lifestyle issues like obesity, which is difficult to overcome. Always discuss long-term effect of on the management of PCOS, premature ovarian failure, and always do the appropriate referral. Now, male fertility. Take how to recognize, assess, and investigate infertile male. Taking a relevant history and arranging the relevant investigation to diagnose male fertility factor. Arranging semen analysis, interpreting the result, and advise repeat the semen analysis with timing whenever required, taking urethral swab and arranging for the management if any abnormality, including referral to gum clinic. Now, one should perform physical examination to assess male reproductive system, orchidometer to assess testicular volume, assess epididymis to detect any abnormalities, recognizing varicocele, testicular tumors, undescended testicles, hypospadiasis, absence of vasa difference, and inguinal hernia. And then arranging further investigation to identify the cause of severe male factor like azoospermia or severe oligospermia with a sperm density of less than 5 million per milliliter. In that case, we should offer a repeat semen analysis, urine for retrograde ejaculation, endocrine, microbiological, genetic like karyotyping, cystic fibrosis, screening, Y chromosome microdeletion, scrotal and testicular ultrasound, and testicular biopsy. And review investigation and make a proper differentiate pre-testicular, testicular, or post-testicular causes of severe sperm abnormality. Now, how to manage such patients? Communicate and formulate an appropriate plan for management of infertility. Explain possible causes of infertility. Formulate management plan as per pathological findings. Counsel couple regarding the different treatment options and always take their preferences and expectation into account. Always discuss complication and the adverse effect about the treatment. Implement management plan if necessary, also modify treatment. If coital dysfunction, that is the reason of infertility, manage that. Appropriate referral whenever required, like urologist, endocrinologist, andrologist, clinical geneticist, psychosexual counselor, and IVF center team. Now, how to manage a woman with an ovulatory dysfunction, including PCOS. Discuss the consequences of expected management. If thyroid disorder, able to diagnose, then manage it and refer properly. Explain treatment for ovulation induction, including anti-estrogens and aromatase inhibitors. Mention success rate like pregnancy and live birth rate, potential side effect of these drugs, complication of procedures, including risk of multiple pregnancy and ovarian hyperstimulation syndrome, and the link with ovarian cancer. Always provide ovulation induction agent and the progestins for withdrawal bleeding whenever needed. Always provide appropriate treatment monitoring to assess effectiveness and minimize the risk of multiple pregnancy. Management of a condition like risk of developing gestational diabetes in a patient with PCOD or the effect of medication in pregnancy. Recognize the influence of lifestyle like diet, weight on and ovulation, and advise on lifestyle factors, especially the difficulties overcoming lifestyle issues like obesity. Now, how to manage tubal or uterine factor infertility. Discuss impact of hydrosalpinx on natural fertility, assisted conception and role of salpingectomy. Discuss effect of proximal tubal disease on natural fertility and role of selective salpingography. Discuss reversal of sterilization. Whenever needed, perform effective and the safe surgery and do refer whenever it is required. Always make accurate notes of operative procedure. Always need to decide when and on whom to operate for diagnosis or surgical management. Always address limitation of operative laparoscopy, open and hysteroscopic surgery skills, and whenever required, always refer to expert. Now, how to manage patient with endometriosis and infertility. Always communicate what treatment is suitable to improve her fertility in case of endometriosis and always refer whenever required. Decide wisely when and on whom to operate for diagnosis or surgical management in case of endometriosis. Accurate maintenance of operative procedures. And whenever needed, we should refer to other specialists like pain clinics and the surgeon in case of endometriosis. Now, how to manage male fertility. Explain possible causes, treatment options, risk and benefits, and need for further referral. Whenever needed, refer urologist, endocrinologist, clinical geneticist, psychosexual counselor, and assisted conception. Always discuss the role of ART and role of donor sperm in ART. Now, how to manage unexplained infertility. First, explain a diagnosis to couple. Discuss with couple about the options, either trying to conceive naturally or deciding for assisted reproductive techniques and timing. Always give them suitable therapeutic options and always take couples' wishes into consideration. Make a care plan with different treatment options, explaining risk, benefits, and alternatives. This is how one should address fertility concern in a male, female, and how you are supposed to manage this. Hi, I'm Dr. Arora. I tried to manage this fertility module in one go. I hope this is going to be helpful for all of you. Take good care of you. Bye-bye.